Good day, ma'am. I am Sandra Dam, and today I will be performing the newborn assessment. The purpose of the assessment is to assess or record if the baby is in normal condition or experiences problems, deformities, and complications. The equipment to be used during the assessments are sterile gloves, bulb syringe, and stethoscope. The first thing that we are going to do is to perform hand hygiene and wear latex gloves. Next is to check for infant safety before, during, and after. Then, we will check for the presence of bulb syringe for the purpose of cleaning the baby's mouth to nose to remove the snot and mucus and reduce aspiration. Then, we need to verify the patient's information through parents and recorded information. Okay, ma'am, so what is the name of your child? Okay, it is Catherine Borromeo. So, what is the birth date? Okay, December 8, 2020. So, okay, now let us proceed to the assessment. So, ma'am, the purpose of the assessment is to assess or record if the baby is in normal condition or experiences problems, deformities, and complications. Then, we need to assess the baby's level of the consciousness. So through inspection and observation, the baby is awake and in quiet alert. Then after, we need to take the next step, which is to assess if the patient is in pain or not. So ma'am, I will just touch the arm of your baby to assess for pain. So when the patient is crying, it doesn't mean that he or she is in pain all the time. It may depend that he or she is irritated by my presence. So like what happened earlier. So the next step that I am going to do is to auscultate the patient. So I will be using the bell of the stethoscope. So I will listen to the heart rate of the patient. Usually, the heart rate of a normal infant ranges from 110 to 160 beats per minute. So I will use the bell of the stethoscope. Okay, ma'am, so your baby's heart rate is 140 beats per minute, which is normal. So now I am going to auscultate the lungs of your baby. So I will listen to the lungs of the baby into the ribs area. So while listening to the lungs, I will check the respiratory rate of your baby. So ma'am, the respiratory rate of your baby is 45 breaths per minute. So the normal respiratory rate of a baby ranges from 30 to 60 breaths per minute. So which means that your baby's respiratory rate is normal. Then during the auscultation of your lungs, I also listen to the vowel sounds. Next is I will assess the patient's head. I will check the suture lines, which are the corneal suture lines, or the crown mohawk, and the sagittal suture lines. So, afterwards, I will assess if the suture lines are overlapping each other, which is not in this baby or your child. And the next thing that I'm going to do is to assess about the shape, consistency, and size of the head. Then, I will assess the eye of your baby using a pen light. To ensure if the baby's eyes are in good condition when flashed by a light, we do not force to open the baby's eyes. Instead, we dim the light surrounding lights of the assessment area and the babies will eventually open. But in this case, the baby is awake. The next thing that I am going to do is to assess the ears of the baby. So I will check for proportionality, shape, and condition of the ears. Then the next thing is to assess the nose. So I will occlude each nostril at a time. This step is necessary to ensure if the baby can breathe from each nostril. C-section babies have stuffed fluids on their nose, which is normal and can be removed over time. I will assess the mouth. I will check for shape, sucking reflex, and rooting reflex. I will use the gloved finger and insert the patient's mouth. Then I will assess the neck. I will check if there are any presence of wibbling, discoloration, redness, or vernix caseosa. Then I will assess the chest. So this is important in checking if there is any discoloration of the skin and other abnormalities that are present. So the next thing that I am going to do is to assess the arms. So I will check for good muscle tone. So in your baby, the muscle tone is relaxed. So I will also check the fingers consistency and number. And I will also check the palmar grasp of your baby. So okay, the fingers number is complete. They are 10 and there is a positive palmar grasp. Then the next thing to do is to assess the feet of the baby. Okay. So I will check for the good muscle tone also for the feet, and then I will check the toes consistency, the condition, and the number. And I will also check for the plantar grasp. Then do the Babinski sign. Then the next thing that I am going to do is to assess the genital area to determine whether it is a boy or a girl. So in this case, it is a girl. I will also check if the labia minora and majora covers the clitoris, which signifies normal. So okay, through inspection, the labia minora and majora covers the clitoris, which is normal. So I will also check if there is a presence of smegma. Then I will check for pseudo menstruation. So the next thing that I am going to do is let your baby turn around so that I can assess the dorsal area or the back. So okay. So I will check the spine alignment and condition. Okay, your baby's back and spine alignment are in good condition. And now, as we finish this assessment, so I will do aftercare to ensure patient safety and comfort. Okay, ma'am, thank you for your time. Okay, Ma'am Katie, thank you for your time and attention during the assessment of your baby. So, please be assured that the information that we have gathered in today's assessment will be confidential and will be within the reach of those that concerns the patient. And then, afterwards, I will document the findings. Okay, so that concludes the newborn assessment. Again, I am Sandrolina Dam, a second-year nursing student at Biliran Province State University.